Welcome to For the Better, a podcast about the people and ideas transforming healthcare for good. I'm Lauren Miners. Join me as we explore how innovation and empathy can create a healthier future for everyone. Welcome to For the Better. I'm your host, Lauren Miners. Our guest today is a good friend, Austen Williams, and she is somebody who has truly done it all and continues to do it all. She's spent over 35 years in entertainment as a model, actress, singer, and dancer, with clients ranging from Ford and Sony, American Airlines, and Toyota. But her impact goes far beyond the stage and screen. In 2014, Austen made history as the first Black woman to win the title of Mrs. America, and she used that platform to travel the world raising awareness about human trafficking. And this work earned her the City of Atlanta's prestigious Phoenix Award. She's since spoken to over 625,000 people across 25 states and multiple countries, including at the Congressional Black Caucus and the United Nations Women's Summit. Today, and the reason she's joining us today, she is the executive director of the Medi, Inc., which is a nonprofit connecting people to healthcare and resources, and she is the president of Crowning Glory Coaching and Consulting. All of this while finishing her PhD in leadership and change. And she's a wife and mom of 4. Please help me welcome my friend Austen. Hey, Austen.
Hi, friend. Thank you.
I'm so glad you were able to join us today. And I want to, on top of all of that, want to acknowledge that we don't actually know each other through healthcare. We know each other through being silly people on stage as improvisers.
Yes.
Yes. And that's so crazy that when we're in the theater, we're not really talking about what we do to pay for the theater classes.
Absolutely.
So it was such a delight to find out that we had crossover in healthcare and purpose-driven work as well.
Yes, absolutely.
I want to hand it back to you, and just start with explaining a little bit about your background and how you came to be in the Medi, because you have built your career on purpose-driven work and advocacy, correct?
Absolutely. You know, as I reflect on my life, I think the common thread has been that I've always done some kind of service. I was that high school student who graduated with 500 hours of community service and was just doing the most. And so I have always wanted to do some version of what I'm doing today. And certainly it has taken turns, and I've done all kinds of things that I couldn't have guessed I would do in a million years, wouldn't have bet money on it. But it's been really incredible to see how much intersectionality there has been in the different paths that I've taken, and exploring the ways that I can bring in my different passions into different sectors and industries during different seasons. So I think most pointedly, I've always been in the nonprofit sector, starting from when I was a teenager, volunteering and being asked to take up leadership positions even as a teenager. And that blossomed into a career. So when I moved to Los Angeles to pursue modeling and acting full-time, I was still doing service work, working with different organizations there when I could to support young people. And from there, I moved to Texas and went into full-time ministry, did that for a few years and went, oh, this is not my ministry. And then started pursuing what I call unconventional ministry. So doing the work of serving people has looked different ways during different seasons. Most broadly, I say that I'm a business and communications consultant for nonprofits and parachurch organizations. Those clients include the Medi, most importantly, which is the bulk of my work today. I also work with a boarding school in Nairobi, Kenya, that serves the most high-performing students from some slums in Nairobi. And I work with a church planting organization that equips church planters with the skills to do community-focused church planting that really builds from the people who are there and already doing good work. So yeah, this is just what it is, I guess.
It's part of, I mean, it just sounds like it's part of your DNA to get out into a community, get dirt under your fingernails, like be in it, because if I'm remembering some of our past conversations, like you can't do it from afar. Like you have to really be in and understand a community in order to make a true impact. And that kind of brings us to, like, let's talk about the Medi and what you guys are, what your mission is, what you're achieving, how you're achieving it. Like, can we get an overview of that work?
Absolutely. Yes. So the Medi is a 501(c)(3) nonprofit that is based in North Charleston, South Carolina, but our work has gone all the way as far north as New Jersey, as far south as Florida, and as far west as Utah. And since we're on the coast, that goes pretty far
Yeah.
to the other side. Today, our primary work is in South Carolina, North Carolina, the District of Columbia, Maryland, Virginia, and New Jersey. And that work primarily focuses on connecting community members to essential health and social care resources and the organizations that provide them. And we do that with a heart of really addressing health disparities and promoting health equity. And I know that those are naughty words today, but those are that's a part of our mission and a part of the core of what we do. And so we've had to get really creative in ways to do that, to address that, and to make sure that communities that need some support have access to that support. We don't own the technology that we use to connect community members to this resource, but our platform allows community members to type in their zip code and then see all of the available resources that are available by zip code across categories. From food, housing, transportation, education. It kind of runs the gamut of all of the social determinants of health, trying to connect to these community members. But I often say that technology without people is pointless, right? So if this technology exists, but people don't know that it exists, well, then that's pointless. And if people are using the technology to get connected to these community-based organizations that provide services, but the community-based organizations don't know about the platform, well, then that technology is still pointless. And so we do the work of community engagement, of doing grassroots, get your hands dirty, be with the people, and understanding that oftentimes, most of the time, albeit I think I might even say all the time, community members, they know what the core concerns of their own community is. And I think one of the biggest mistakes that organizations can make when pursuing a community engagement strategy is like going in like, hey, let me fix your problem. Let me tell you about your problem and fix it. Because almost always there's already someone there who's doing the work, who's familiar with the nuances of the specific cultural or contextual dynamics that are happening within a community. And as an organization, the Medi believes that we can go farther faster by identifying who those players are and supporting their efforts in order to affect greater change and provide greater impact. We call it impact multiplication because we think that there's just exponential growth when we do it that way, that we can go further, faster together and get more of what we want and less of what we don't want. So the heart of our work is really community engagement.
Yeah, you make such a good point about the fact that different communities have different cultural nuances. And I mean, of course, it would be off-putting for anyone to come into a community and be like, we see that you have this problem, and guess what? We know exactly how to fix it. Here's the blueprint. It'll be fun, rather than to pay attention to just the history of a community, how things have evolved over time, what their triumphs have been, what their scars have been too. I mean, I can imagine that even though sometimes these programs are meant to help, they can be met with some skepticism, right? Because of just cultural nuance.
Absolutely. I think that that's really an important point, right? Because at the end of the day, like people are peoply, right? People are just peopling. They're peoply, right? And so we have to meet the people where they are. And I always say be curious instead of corrective. Right? Like instead of identifying issues, maybe come in with some questions like, hey, to your point, Lauren, what are your triumphs? What has happened? Where have the gaps fallen? What are ways in which other organizations or people or programs have come in and promised you the sun, moon, skies, and all the things, and then that fell apart? And how has that sown distrust within your community or perpetuated negative cycles? I think equally as important as addressing like the core concerns of a person is really understanding the greater systemic challenges that that community is trying to take on as well. So, the way I describe it, I say I care about the forest and I care about the tree. And so we
Yeah.
have to look at how this larger ecosystem is interacting together. And we also have to care about how that larger ecosystem is affecting that one tree that's also like alive and worthy of being acknowledged and thriving. So, we try to do the work of both, addressing the forest and the tree.
Yeah, I love that metaphor because it does it's regenerative, right? When
Hmm.
you help one person, that creates a ripple effect. When you help the community, there's sort of an internal ripple effect. And, when you're focusing on both the community and the individual, I think it would tear down the tendency, I think, that all humans have, which is to identify people or communities as a monolith and
Yes.
just and sort of a broad brush of, okay, this is a county in Kentucky and, they're struggling with opioid use or something like that. And not really dig into, okay, but why?
Yes.
And hear the individual stories to help tell the larger story so that you can actually identify what's going to be like the first next best step. So I
Yes.
love that philosophy and that you guys are
Absolutely.
taking that.
Thank you. Really
Yeah.
appreciate that. And that makes me think of, as we have done this work across these different states with very different cultures, like the culture of South Carolina and North Carolina, like way different than Utah and West Virginia, where we've also done work. But we've seen success in this model of community engagement because it starts with people centered care, and it starts with trust and recognizing that these things in a silo don't actually equate like activation and implementation, right? If we want a community to rally around a thing, then it takes all of those things and intentional and strategic community engagement. So it takes us going like, hey, who are the leaders within a community? Who are the organizations, or what are the organizations that are doing this work? And how can we partner with them to really leverage their relational capital to garner trust, to lead to adoption, activation, and opportunities to do this community building work? Because at the end of the day, like for us, especially because we live in nonprofit land and we know how difficult it is for community based organizations, we want to be an asset to other community based organizations and nonprofits, because what nonprofits for sure don't need is more work. We
Right.
got a lot of work and we don't have a lot of resources oftentimes.
Yeah.
And so, as a part of this community engagement strategy, it's not just like, hey, nonprofit, we'd love to send you some more work, as if they are not often overworked and underpaid. We want to instead go like, hey, we see you. Here are resources that can help you streamline your processes, provide you with quantitative data to measure your impact and efficacy, and really give them tools to turn their data into dollars. And go over best practices with them, and say, like, here are ways that you can leverage these data and analytics, so that at the end of the day, you can continue to do good work for a good long time. And if we all kind of work together that way, again, to bring it within this ecosystem kind of language and context, if we all worked that way, again, we could go further faster, because then we're creating an environment where, for real, all ships will rise with the tide. And like, maybe my ship is different than your ship, but if my ship is in better shape, can go like, hey, let me help you patch up your ship. Let me help you patch up your boat. And we can see communities and people flourish.
Yeah, absolutely. And touching on what you were saying about we're not bringing nonprofits another tool in order to give them more work. We're positioning it as something that can help streamline. The last time we talked, I thought it was one thing that stuck out to me about your platform that you have is that it is a tool for community health organizers and people in nonprofits to help help the individuals that they are faced with every day that have resource needs that need to be connected with different things. But also, I love that it is available to anyone so that they can have agency over their own solution. Because I think you mentioned this, it's like, if you're in crisis, the last thing you want to do is go admit to somebody else that you need help. That is incredibly hard. It is hard for me as just a regular person walking around to ask for any kind of help. So I can imagine someone in crisis it can feel debilitating. And this gives them the power to find what they need without having to go down like 16 different Google searches and all that sort of thing.
And repeat the nuances of their hardest day over and over and over again, right? So like we say, dignity and ease. We want it to be easily and readily accessible for them. And we want to be able to like preserve these people's dignity, because I think doing this type of work, it can be really easy to go to data and go to numbers. But data and numbers represent real people with real lives and real stories. And they're real. And they are deserving and worthy of being cared for as a whole person and having access and to use your language, agency over what it looks like for them to try to advocate for themselves, to be empowered to find the things that they need in a way that cuts through the noise. And so our platform gives them the ability to go look for what they're looking for, but also go, oh, I didn't even recognize that I also could use help with this. One of my very favorite stories of this kind, one of the language that we use, a person looking for help is a seeker. A person who is helping a person look for help is a navigator. So one of our partners up in Baltimore, she has founded her own nonprofit and does a lot of community health worker type of work within the auspices of that organization's missional purpose. Her name is Teely. Teely was just a huge advocate for using the tool and connecting her clients to the platform. And one day, she took her son had a medical condition and he needed some care. And so one day she was trying to help somebody else, but one day she was looking up information to help somebody else, and then saw a resource that would help her get her son the care that he needed. And so then she went to the doctor and was like, hey, I got this grant from this platform to get my son this care. And the woman who was the receptionist was like, wait, my son needs some treatment too. Like, how did you find this? And she was able to pull up the platform on her phone, type in the information and say like, hey, here's this platform. Here's how you access this resource. And the receptionist was able to get it too. And it's amazing that like, even as a navigator, she was able to connect with resources that she needed and then pay it forward. All ships rise with the tide.
Yes. Oh my gosh. That's such a cool story because, yeah, I mean, having navigated a few things like for my aging parents and strokes and, that kind of stuff, like you have to dig. And if you are somebody who's already digging for someone else, like you're not immune to having your own needs too. Like
Absolutely.
that's what I mean, like when we talk about health equity and digital health equity at Reason One, like that's what we're talking about is that everyone is going to need something at some point, and they're going to be in crisis, confused, met with probably a lot of unhelpful resources or I don't know, or man, that really sucks and I wish I could help. But we're all going to need something at some point. That's like part of what community is.
Absolutely.
What a cool story. Well,
yeah.
Segueing on that, what are some of the other success stories that you guys have had as you've grown this up and down the East Coast and out West. And can you tell us, like, when the Medi is able to get into a community and, make those connections and use that capital, how has that manifested into real change that you guys have been able to see?
Absolutely. So again, we've had to get creative in the way that we implement our work. And so one of our projects right now, we call it the Workforce Forward Project. And we are working with employers and small business owners to provide their employees, particularly employees who are in the ALICE population. ALICE is an acronym that was started by the United Way. It stands for Asset Limited, Income Constrained, Employed. So they're people who work full time, sometimes two jobs, but they still don't earn enough to cover their basic needs. And people in the ALICE population, like, they just don't look the way that we expect them to look because they might own a home, they might have a car, but they're the people who they're constrained, truly. And so we are now partnering with small business owners, employers, in order to make sure that the platform is accessible to these types of employees, to this population of employees. And we work with human resources, we work with chambers of commerce. Here in the Low Country, we have a partnership with Low Country Local First to provide access to their network of business owners and hospitality groups, especially in a place like the Low Country, where our largest industries are most likely to have workers who are in this ALICE population. And so it's been really cool to see this work unfold here in Charleston, especially, or in the greater Charleston area. The whole Tri-County area,
All
we
of it,
got
the
you.
Low Country broadly.
But this particular project is being brought here after successful projects in New Jersey and North Carolina. So our organization, through a public-private partnership with the state of New Jersey and the state of North Carolina and a company called TrueSight, respectively, have been able to do similar work in Monmouth County, New Jersey, and in Stanley and Cabarrus counties in North Carolina. Being an organization that is headquartered here, I thought, like, no, we have to bring this here. We have to bring these projects and this work into our backyard to take care of. This is my community. Like, I live here, my kids go to school here, and my family is here, right? So if I'm serving these other communities, I want to also make sure that I'm serving my own. And this work has gotten us some grant awards that we're really proud to have partnerships and have support from Roper St. Francis Health Systems and the South Carolina Association of Community Economic Development, the Coastal Community Foundation, Dominion Energy. And we hope to just continue to be able to build upon the work that we're doing here. But, it's difficult right now for nonprofits. A lot of our funding has been restricted or constrained, and we're competing for far fewer dollars than we once had access to. So we continue to be a work in progress. And if anyone out there in the interwebs would like to learn more, support the work that we're doing, would love to share more, would love to provide the tool to any business owners in the area and find out how we can build this ecosystem together, for sure.
Yes, absolutely. And our listeners are really all over the country. There are healthcare marketers all over that I think need to hear this, especially, going back to what you were talking about, the ALICE population. I have been a part of that at one point in my life, and know plenty of other folks who have been there as well. And man, if I'd have known that there was something, when I was 19, 20, up to 23, I definitely would have used that. And when you think about a community like Charleston, or like any other community that does have a large piece of their economic development centered around tourism, if the people aren't showing up to work because they do not have the resources they need, that's a ding to your economic driver in your city, in your town, whatever. So we have to take care of the people. You have to take care of the trees to take care of the forest. Absolutely. I love this.
There's there I love trees. And I once heard, I really love trees a lot. I heard this story about how redwood trees operate within their larger ecosystem.
Oh, yeah.
And during times of drought, those trees will provide water from its reserves to the trees surrounding it because it recognizes that if those trees don't do well, it will also not do well. And so I think that that's such a beautiful picture of what it looks like and means to build an ecosystem of care. It means going like, oh, I recognize that if I can support you, you will also support me. And so that's the work that we're trying to do. And that's really the purpose of, I think, being a part of a community, even in terms of my PhD is in leadership and change. And when I think about what it means to be a leader, what it looks like to be a business owner and support those folks who come to me for their provision, right? It means that I have to recognize that if I want to flourish, I need my people to flourish too. So a healthy workforce is going to increase your productivity. It's going to increase retention. It's going to increase morale and drive the type of organization that a strong leader is trying to build and a strong business owner is trying to create in order to see their businesses be successful.
Yes. And I love the I prefer the term ecosystem over network because I personally feel like network sounds very transactional. An
Yeah.
ecosystem is like there's some feeding going on there too. And it recognizes that everyone is doing something a little bit different and that you
Yeah.
have to have all of it. Like
Yes.
it can't just be like your metaphor of the forest. Well, like there's all different kinds of plants in the forest. It's the trees, there's bugs, there's birds, there's squirrels, they're all doing their little jobs and that's feeding the whole thing as a whole.
Exactly.
Almost the call to action for us to like recognize where we are in our ecosystem
Hmm.
and then like what our job can be to help feed
Yes.
the rest of it for sure.
Yes. 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 Landed that plane so beautifully.
Love
Absolutely.
it.
Uh,
Love it.
yeah. In a perfect world, wouldn't it be amazing if that really was the value proposition? If like really we're looking at our larger community and going like, I recognize that you bring something to the ecosystem that's different than mine, but like the ecosystem doesn't flourish if we don't bring our own thing.
Right. Yeah. Yep. Totally. And that's recognizing that and using our gifts and our different positions and where we kind of sit in a constellation of the ecosystem is how we reach equity. It's how we reach parity, right?
Yes.
Amazing. So, okay. So, how can people connect with you and follow you because you're amazing? And then also, how can they connect, follow, and support the Medi?
So you can get in contact with me through the Medi's website at www.themedi.org. I am also on the social media, but admittedly, I'm a very irresponsible social media user. I come in peace. So you can find the Medi on all social media under the Medi, Inc., INC. And I am at Austen with an E. Beyond that, again, we would cover any support that you all would be willing to provide, volunteer hours, ecosystem building. Building an ecosystem takes people power. And I think that the greatest nuance of the work that we do is that it's community engagement. It doesn't, sound as good on a flyer as like fight human trafficking or in childhood cancer. There are things that have an urgency just as a title. Then what they are is urgent, but we think that the work that we do is deeply impactful. And so while it is maybe not as like in your face urgent, this work that we're doing addresses all of those urgent things as well, because the social determinants of health, they their intersectionality of all of the things. Am I
Yeah.
right?
Yes. Yes. Exactly. You can't ignore that. again, people are individuals. They are not monoliths. And
Yes.
it's gonna take all of us. But thank you so much for hanging out with me today, Austin. This has been an absolute joy. I always love spending time with you. I'm gonna have to have a reason to bring you back soon for like
Please
a part
do.
2. Yes. And yes, go follow Austin, check out the Medi, reach out to her if you want to get involved. And thank you again for listening. Thank you for being here.
Thank you.
This has been For the Better. I'm your host, Lauren Miners. Production by Liesl Epps. Graphics by Liesl Epps and Danielle Sally Creative. Illustrations by Flavor Graphics. For the Better is sponsored by Reason 1.